Hi, everybody. Welcome back to another Thompson Foundation podcast. And today we start a series of interviews with our certified instructors to get ready for our conference that's coming up this July. So today's guest is one of my favorite chiropractors, Dr. Mike Sredniawski, who it was a student. He was a little bit ahead of me in college, and he actually helped me out so much when I was in the Thompson Club. He taught me the basic Thompson technique when I was a young student, and so I owe so much to him, and I'm so thankful for him. So welcome, Mike. How are you?
Hey, thanks, Beth. It's great to
Gosh,
be
we
here.
we
It's
go
been
back a
so
long
long.
time.
It's been
Yeah.
a long time.
Yes, those were such great years to be at Life too. What a good
Sure
experience.
were. Yep.
So, could you just start off by introducing yourself to everyone? Just tell us first, how did you become interested in chiropractic?
I think I remember Dr. Boylston asking that in the first quarter. And I remember Keith Sigafoo saying, chiropractic got into me.
Oh, I love it.
But I always think about that whenever I'm asked that question. But actually, it's funny because it has a lot to do with Thompson Technique. And it was, gosh, back in the middle 1970s. My mom used to go to a chiropractor for back pain, and she injured her back when she was in high school. And she had seen a chiropractor on Long Island, which is where I'm at now. And then we moved to Jersey. She found a chiropractor there. His name was Dr. Bob Ambrose. And some people watching might know a guy named Steve Ambrose. Well, that's his father. Um, so Bob Ambrose was a very busy chiropractor. I was a little kid. I used to sit in the reception area and look at charts just like this right here, and study. I actually just there was nothing really to read on his office but studying the nerve system charts. Anyway, I used to see people coming and going, all the way crazy, bringing in plates of food and cookies and chickens they just butchered from their farm. This is in rural New Jersey. Anyway, fast forward to 1978. I got really sick with a bad strep infection, and it was really horrible. I had just like the worst symptoms: headache, nausea, vomiting, fever, and it wasn't responding. My mom's a medical; she was a registered nurse, and I just wasn't responding to any of the medications. She took me to the doctor, the pediatrician, after being sick for almost 7 days at this point. And he suggested another medication. And I looked at her and I said, "Why don't you take me to Dr. Ambrose?" And he goes, "Who's that?" She goes, "My chiropractor." "Oh, chiropractor." And he goes, "Oh, okay, whatever." And she took me right after that visit. My dad left work because he was concerned that I wasn't getting better. And he was like, "This is crazy. What does he want to go to chiropractor for?" We go see Dr. Ambrose. He didn't say a word. He laid me on the table, adjusted me. I still remember my first adjustment at age 7, where I was just
Wow.
my head was spinning, and literally. And we got home, and it was about an hour later that everything just dissipated. The headache was gone. The fever broke. I started to feel my energy come back. I just looked at my mom and said, "Anytime I get sick, you take me to that guy first, because that's what worked." And then subsequently, she went back. She's like, "How did this work?" And he just said, "It's just because you align the spine, you take the pressure off the nerve, just like we all know." And he said, "Why don't you just come like every week as a family to prevent yourself getting sick instead of waiting till you get sick?" I'm like, "What a concept!" So every Friday night, we would go to Rodolfo's Pizzeria in Rocky Hill, New Jersey, and then we go to Dr. Ambrose for an adjustment, and that was our routine since I was 7 years old. And then when I got to Life University, Life College back then, it was interesting because his son had enrolled in chiropractic school, and he was, I guess, about a year ahead of me.
Oh,
And
wow.
so he hosted me as a visitor. And then when I enrolled into chiropractic school there, I was looking on the walls in one of the, I guess it was Annex B at that time, one of
Right.
two buildings or one of three buildings. And I saw these flyers for clubs, and one said Thompson Club. And I had no idea what any of this stuff meant. And I walked down the hall and I peeked in and I saw a really cool looking adjusting table. And I said, "I got to learn how to use that thing, man. That's awesome." And it was the Zenith 440. And I started to go to club because of that. And then when I went home to visit, the first time I was able to go back home, I visited Dr. Ambrose and I saw he had the same tables. So it
Uh,
was kind of like meant to be. You know, I had no idea what the tables were, and then I didn't even know when I got to school because it had been some time. It had probably been about 8 or 9 years since I had last seen him.
Oh,
Um,
wow.
yeah, because we moved again. We moved to from Jersey back to Long Island. We hadn't seen him regularly. We were seeing another chiro, and so he was kind of out of sight, out of mind a little bit. And
Mhm.
seeing the table kind of brought back a subconscious fond memory. And there you have it. So that was
That's a great story.
yeah.
I think all chiropractors have a huge percentage of patients that are nurses. Like, nurses love chiropractic. And that's great that your mom took you to the chiropractor every Friday. That's
Yep,
amazing. What a
yep.
what a good start, she
And
gave you.
she eventually worked for him after that. He offered
Oh,
her.
really?
Yeah.
Oh my gosh, that's great. Well, so people that are listening that, maybe didn't go to Life College has, I think, since the very first Thompson Club started, they have always had a really, really strong Thompson Club
Mhm.
with great instruction, great speakers. So, tell us a little bit about the Thompson Club back in those days, because as a student just starting at life, I was really intimidated to take the Thompson Club
Right.
classes, because I felt pressure, like everyone would expect me to know everything and I didn't. And it was just the greatest group of people, and everyone was so knowledgeable and such good teachers. So tell us, like, why do you think that club was so successful and remains still so successful?
You I'm just trying to think back. Gosh, this is 28 years ago. I'm trying to see if my memory serves me properly. But I just remember to answer that question. I remember when I was there, it was busy. There were always a lot of people there.
Mhm.
And I remember my first day in Thompson Club, and I remember that was, you remember Frank Costa? I
Oh,
don't know if you,
yeah.
okay. So God bless him if he's listening. I don't know if he ever would listen to this, but I thought I killed him when I adjusted him.
Oh, no.
Yeah, it was a prone head of the table cervical with the drop, and and I forgot who was teaching me. Some upperclassman was teaching me, um, and I just adjusted him so hard. But it was just, I think that what leads to the success of the club, um, first of all, I think because the philosophy of the club and the philosophy of the people learning that technique is that it's an analysis that anybody can do and
Mhm.
everybody can learn it fairly simply and it's comfortable. I mean, you can get it pretty quick. And then once you get that, you have a sense of confidence. And when you're confident, then you just have to perfect your technique, your adjusting skills. But I don't think it was beyond anybody else to discount any other adjusting technique. So
Mhm.
it wasn't that kind of feel. The vibe wasn't there. It was just like all welcoming. Everybody could just come, no matter who you are, no matter what technique you specialize in, and you could learn and you could always just benefit. It was just one of
Mhm.
those all around great, all encompassing techniques that kind of took in everyone.
Yeah.
And still to this day, it's like what you kind of, what we were talking about earlier before, I guess, on the text was one of the things that I want to show at the convention is how you can utilize the technique and not necessarily have or how to utilize the analysis and have a different technique with adjusting and application. So I think that was mainly it, and it was just really great because there's a lot of technique in Thompson analysis and Thompson technique that can afford a practitioner to properly correct a subluxation and not use a tremendous amount of force.
Right.
Um, so it all depends. It depends on where you're at, how you practice, what kind of tables you use. But I think as far as club, it just generated a really good vibe. And I
Yeah.
haven't been to the club since, gosh, 28 years. So I wonder if it's the same. I hope it is.
I believe it is still really solid, so I'm really
Yeah,
proud of them. And
cool.
we also have Thompson clubs now at Sherman College and Life West, and we're trying to get one going at Palmer. So this is
Perfect.
exciting times for the technique.
Cool.
So what Mike was talking about is that this July 7th and 8th, we're having a conference. It's our first annual Thompson Technique Foundation Conference in Davenport, Iowa. And we chose those dates because July 8th is Dr. Thompson's birthday. So it's going to be a real celebration. And we're going to, really make it a lot of fun. We're going to have an after party at the Delt House, which will be a lot of fun. So one of the things that Mike will be teaching is how can you just use a flat bench and adjust subluxation using the Thompson technique analysis? Because oftentimes, people may say, well, I don't want to, go to a Thompson seminar because I don't have a drop table. And what we want you to understand is that this technique is both an analysis and an adjusting procedure. So you can use an analysis. You could use it with a flat bench, with an instrument, and so Dr. Mike is going to show you how to use the Thompson analysis and adjust on a flat bench, which I am excited for that because, to be honest, I'm a little rusty on that since I always use my drop table. So I'm going to be paying close attention when you start teaching that.
I think one of the main motivations for me when I was in school, and I have to admit, it was, I guess if I look back on it, it would be somewhat of an ego trip, because I would always get offended if people were to make a comment and say, because after a while, Rick and I were co-presidents, and when you're kind of like the guy in charge, there's a lot more pressure at that for some reason. People expect more out of you, but then people would criticize and say, oh, you're doing the drop table, that's a crutch. You can't, you don't really know how to adjust. And I'd be like, and that would get me incensed. I'm like, I can adjust.
Yes, I
And
can
I had
tell
to make
everyone you are an
sure.
awesome adjuster. Yeah, so yeah, we want to give a shout out to Dr. Rick Markson, who was
Yeah.
also, president at that time. And of course, he's gone on and doing other things. But when we started the Thompson Foundation, we grandfathered in a group of chiropractors who are excellent with the Thompson technique. So Dr. Mike is one of those, and Dr. Rick Markson is also on our list. We just haven't talked him into coming back and teaching for us. But Rick, if you're listening to this, we're calling you out. We want you back teaching. So
No,
anyway,
we had a great time.
yeah, those were so great, such great years. So I am very excited that Mike is going to be starting to teach more seminars, and now and going forward, we are happy to have an instructor that lives in the Northeast. So if you're from New York, New Jersey, the Northeast, we'll have you reach out to Mike, and if you have like a state organization or something, you're looking for a good instructor, please reach out to Mike. Maybe Mike, we could put your contact information in the comments section. Is that okay with you? So people
Yeah.
know how to reach you.
Do I do that or do you do that?
We'll do it when I post it. I'll do
Oh,
that. I'll add it in there. So, is there anything else you like? Any
yeah.
comments or thoughts
Yeah,
you have?
actually, just in terms of talking about the technique, I mean, this is now 28 years later, right? So I'm in practice. I'm an old guy now. I'm an old timer. You can see, right? See?
I know.
Um, but it's really great because just yesterday, actually, you know what? Just this morning, I don't usually come into the office on Tuesdays till the evening hours. And somebody called me, somebody texted me, they said they had to come in. I saw them at noon today. And it was just funny because when she walked in, now you have to understand, when people come in, they have all different reservations as to, like, she's been adjusted before, she's been to chiropractors before. And this is what she says to me. She goes, I go, so have you had an experience with chiropractic? She goes, yeah, I've been to several chiropractors. Absolutely. And she goes, but I'm not looking for that 3-minute, you're in, you're out, wham, bam adjustment. Get my crack, and I'm out. And I go, wow, so what are you used to getting and what are you looking for? I ain't
Exactly.
one of them rubbing doctors either, so, but it was interesting because she comes from that place. And she said there's so many times that they'll just crack me real quick and throw me on electric stim. And then I'm there for a half an hour cooking. And then I leave after that. And I had to assure her, number one, I said, first of all, one of the main things that I focus on in my practice is to make sure you're adjusted, not just cracked, but adjusted
Right.
properly. And I said, and what I mean by that is that what my mission is to look for that subluxation. I want to find that subluxation, and I have a definite form of analysis where I can find it and I know how to correct it. I go, so you're not going to get anything cracked. You're going to get adjusted what needs to be adjusted, and anything else like electric stim, heat, ice, any kind of therapies, that's all fine and great. It's not chiropractic, but it doesn't belong in my office. And I go, so you can do those things and they're not bad things. It's just not part of what I do in my office. So when you're here, you're only going to be here for a minute to 3 minutes, possibly. And it's not a wham bam thing, but I know when I find it and I fix it, that's it. It's all I need to do. And so I know with confidence that with using the Thompson analysis, I know exactly. So this is the funny thing, okay, leading up to this. So I have this conversation with her and she goes, all right. I go, so this place may not be the place for you. It just
Right.
may not be the place for you. And I said, but I know that I can help you if you have subluxation. She goes, okay. So number one, I can speak with authority
Mhm.
because I know what I know and I know I'm good at it. Number two, when I checked her and I do my leg check analysis, I walk her through the whole thing. She's a new patient. I go, let me walk you through this, what I'm finding. And
Mhm.
I do their leg check, and I actually sometimes I'll tap their feet together so they can feel like if it's they feel the
Ah,
inside of the one foot hitting the other. And then I
oh, I
do
like
this a
that.
little bit. I go, do you
Mhm.
feel how that's is that even or uneven? They go, wow, that's off. And like they feel it, you know. So and then I do the raising the legs. I have her turn her head, explain subluxation, cervical syndrome, and she's like, "Wow, nobody ever did that. Nobody ever explained that." And to me, I'm thinking this is elementary to do this every single adjustment, every single.
Right.
But to the patient who doesn't know better, some other chiropractor might not even do an analysis. They might not even palpate. They might just go to the point of pain. If it's a low back pain patient, they'll just hit them on one side and hit them on the other, and then they'll pop and
Mhm.
pray. And they think they're doing chiropractic. And I feel really strong against that because it's not
Yeah.
chiropractic and it doesn't educate the patient. Um, and then I love the light switch. The analogy of the light switch. I think it was either Brian Lieberman. I think it was Brian that said this. I think it was him. But I'm going to give him credit for it anyway. Maybe it was Dean Sitroy. But it was the light switch, and they want to know how long does this take. I go, listen, here's the light switch. I turn the lights off. I turn it back on. I go, the difference between light and dark is obvious. I said, but I'm not the power source and I'm not the light, and I'm just the guy flipping the switch. And I go, and if I rub it, it's not going to make the light any brighter. So I
That's
don't need to
right.
sit there and talk to it. I don't need to rub it. I don't need to add tilt to it. So like these are things I'm always saying every single day in my practice, and because of the analysis, here's another thing really quickly. I know if I'm talking too much, just let me know.
No, this is
But another
awesome.
thing is this unbelievable. There's a young guy, a Sherman student, who I'm friends with now, and he actually challenged me on Facebook, the Facebook ad, and
The
so I
Facebook.
direct. Yeah, it was a Facebook ad, and then it's funny because I never advertise pain, I never advertise symptoms. Sometimes we'll put like bullet points, like the asthma, allergies, ear infection, but like chiropractic helps you get better, helps you improve your performance, all that stuff. It's not always just a back pain thing, right? So for years and years and years, I never advertised. COVID hits, and then people have complaints about chiropractors even being open. So
Mhm.
New York State had regulations. We were only allowed to adjust essential workers, and we were only allowed to adjust or see them if they had a pain level of a 5 or more on the
Wow.
10 scale. So I catered my Facebook advertisement to, you know, attention, essential workers who have a pain level of 5 or more. Chiropractic can help. We're here to help you. Um, this kid chimes in and leaves a comment, and he says, you sold out because
Mhm.
chiropractic is so much more than just pain relief. And I'm like, good grief. The one time I advertised. So I challenged him to come in. I said, you come to my office and you see what we do, and then you can make your judgments and assumptions. Now, we've become friends ever since. It was about 2.5 years ago. And he's going to intern, do his PMOE, I guess they call it, the externship or
Uh-huh.
peak that some life calls
Yeah.
peak. Yeah.
Mhm.
So he's going to do that in my office coming up in a couple of weeks. But the good part about the analysis was that while he was shadowing me, every time he'd come back, he'd shadow, and then he's like watching, an inquisitive first quarter patient student, and I'm showing him the technique. I'm showing him the analysis. He goes, "Wow, it's so good to see a doc in the field, especially as long as you, who's actually doing analysis." Because there's so many people who don't do analysis, and there are people who do, obviously. But it was just refreshing because I know I could have a student come and I'm not embarrassed about what I do. I don't
Mhm.
feel unconfident, So,
Yeah.
and then
Well,
we
that
had a Thompson
it
seminar in our office.
it is, Thompson Technique is a great foundational technique for students because it does give them that confidence And, ever since I was in school, I don't know if you remember, Pinkus Neumann,
Of
and
course.
I had the thermography club. And
Yeah.
so, from the very beginning, I've always used instrumentation to kind of see, like, did I do the right thing at the right time? And I found, that the Thompson analysis will get you to the primary subluxation 90% of the time. Is it
Right.
100%? No, no technique is, but
Right.
90% of the time. And that gave me so much confidence as a brand new doctor, seeing patients, because I'm like, you know what? This is a really great analysis. And I feel confident taking care of these patients, even though I am so green. I'm
Yeah.
brand new at this. And so I think it is a great technique for students, but it's a great technique for all of us old timers too. And it does help you become more specific.
Yeah.
And like you said, the patients feel like you are very thorough. They
Right.
appreciate that.
Yeah.
And they also appreciate it when you say, "Hey, your legs are balanced today. We're going to leave it alone." They appreciate that too. I mean, they want to know that you are addressing their specific issue and that you're not just doing the same thing to every patient. And they really
Well,
like that.
you brought up a good point because it just even yesterday this happened where somebody, a lot of times we'll have someone on the table and a family member is next to me. So they're inquisitive and they want to watch, they want to look at the leg check and they're just
Mhm.
amazed every single time. And then there was a 14-year-old on the table, a kid, he's a bowler and he's actually a really good bowler. And his mom was next to me and she was looking and he didn't need his neck adjusted yesterday. And she goes, "How do you know?" And I go, "I know because this is how we know." Show her the leg check. And I go, it's one thing to be a chiropractor and know how to adjust somebody, but it's also almost more important to know when not to adjust somebody.
Exactly.
That's a huge thing, Beth. That's a huge thing.
Yeah.
Um, Another thing that happened, yes, oh my gosh, these things are so current. It just yesterday I had a beautiful group of people come in. They're all friends from our church, and they're all around 28 to 30 years old, and they're just so excited about chiropractic. They just love it. And they're multiplying in droves. They keep bringing their friends in, and it's really kind of cool actually. So we had a bunch of them sitting right outside. I was in this room, and I was checking one of their new friends that came in, and they saw the leg check, and she suffers from really, really nasty migraines. So she turned her head, and her legs got completely balanced from like an inch and a half.
Mhm.
And then one of the friends outside says, "How does that work?" That's like that's the kiss of death. If you ask me, how does something work? I'll tell you. So I go into the dentate ligament cord distortion. You're like, remember that, right?
Yeah.
Explain the whole thing. And I even have hold on. I mean, this isn't the cervical vertebrae, but it's a picture of a vertebrae. So I'm just, using it as a reference to describe the
Uh-huh.
neural canal. And, anyway,
That's awesome.
yeah. So it's just kind of funny how like it still comes up 28 years later, and this is the stuff that when we were in college, Rick and I went to Minnesota, and Rob Jackson had us teach the dentate ligament cord distortion theory to a bunch of docs at a
Oh,
seminar in
that's
Minnesota.
awesome. Yeah,
Like,
we were so fortunate to be at Life when Dr. Grostic was there, and we were exposed to a lot of different ideas about subluxation, different subluxation models, and
sure.
so shout out to Dr. Grostic, and who else shout out to? Dr. Jerry Hockman. What an amazing mind in chiropractic. So everyone probably knows him more as SOT teacher, but people may not realize he was certified by my grandpa in the Thompson technique.
Brilliant
And
man.
so he is one of the most brilliant minds. I mean, this is the thing that I love about the people that teach technique, because oftentimes I think that, like, the field or the student thinks, "Oh, all these different technique people are in competition. They don't like each other." That's not true.
Not
And
true at
all
all.
of these technique developers, they were friends and they were sharing information. And, for us, for the Thompson Foundation, we don't bash anybody. We do our thing, but we realize that as a chiropractor, you need lots of tools in your toolbox. Remember, my grandpa would say that. And so, there's still much to learn, and I hope that all these young chiropractors are developing new technique. I mean, there's always room for growth and for new ideas in the profession, for
I
sure.
learned I learned a few things to add, even from Lieberman. I went to visit Lieberman a few weeks back in January this year, and they say you can't teach an old dog new tricks, but you can because he was showing me stuff. I think I mentioned it to you on the phone,
Yeah.
about like arm length, the arm length test, and using thermography with that, because we have a just the regular digital surface thermometer, surface temp thermometer,
Yeah.
surface thermometer, but it's digital, so you can read it. And then he came up with, I think him and his associate came up with some things to add a little more specificity to the upper cervical. So, like, let's say you get a cervical syndrome, turn your head to the left, you have a cervical syndrome. It's somewhere on the right, and you can palpate. But then, rather than just relying on your palpation skills, because sometimes you might not get a tender nodule with an atlas. So if you're or an occiput. So if you're doing this extra analysis, it's something to add to just separate atlas occiput C2 from the rest of the cervical spine.
Does
Just
he do the arm? Does he do the arm length check prone or supine?
supine.
Yeah.
Yeah,
Do you remember Dr. Millette? We
I
had him.
remember the name.
Yeah, he had this whole supine arm length check, which I did actually, if you're listening, I posted it a while back on the J. Clay Thompson Technique Foundation Facebook page. So if you're interested in that, kind of scroll back and try to find that. I did post that document that I'd saved from way back when. But it just makes sense. I mean, if subluxation can cause a leg to contract, why wouldn't it also affect the upper extremity? So it's
It
pretty
does.
smart.
And you know what's funny? It's like when people are rotating their head, you can see the arms change, and then when you do the thermography, you can check the temperatures. Like, literally, I'll have somebody with 3 degrees difference from left to right side of Atlas
Oh,
Fossil.
that's very significant.
It's significant. And then we adjust, and then they're literally within like zero point 0.2 or 0.3 degrees, and it's
Oh, that's
like that.
beautiful. That's
But what's
beautiful.
cool though is that you do that, and you can show them the temperature reading, and
Mm,
then they say, "Well, how did that happen?" So now you've got real good chiropractic
that's
table
that.
talk,
Yeah.
and then
I
you're explaining the nerve system.
Yeah, I think, the Thompson technique allows you to explain to the patient both through the leg check analysis, like your body, the doctor inside your body is showing me when to adjust and where.
Right.
And so you're always putting it back, the healing back with the patient. And so it's very easy to teach the patient our philosophy through technique, which I think
Mhm.
is really awesome too.
Yeah, you can't have one without the other.
Mhm.
And side note, just saying, since doing that and adding that to what I was already doing, it's like I'm actually adjusting. I feel like I'm adjusting less.
Mhm. That's
And people feel like they're getting more, and they
that's
go, "Wow,
awesome.
it's really intense comprehensive adjustment." They're like, "Wow, we did so much," and I'm like, doing less. I'm just, but it's really great. So it just keeps you really.
You're gonna have to show me Brian's
Yeah,
protocol,
yeah, it's cool. It's
or
really
else
cool. It's easy.
I'll have him ask. We're gonna both be at DE, I think, coming up
Yeah,
also. So we'll
yeah,
have to have a little technique session and have him
perfect.
show us what he's doing. I
Cool.
know Greg Demetrius's daughter Caitlin. She spent some time, I think, there, and
Oh, with that.
she really thought the world of him. So,
Oh, Brian's. Yeah.
yeah. Well, hey, Mike, I just want to thank you so much. I hope this gives everyone a good introduction to you. If you are interested in coming to our annual conference, please reach out to either me or Mike or any of the Thompson board or foundation. We have information on the Thompson Technique, J. Clay Thompson Technique Foundation Facebook page. But I'll put my contact information and Mike's in the comments section of the video. We hope to see you all in Davenport this July 7th and 8th. We're going to hope and pray we can get maybe a tour of the BJ Mansion. We're working on it because they're on break right then. So if they can get someone to be there, hopefully we can work that out. So anyway, Mike, I'm so happy to connect with you. I love you so much. You're such a good
Me
friend
too.
and a great chiropractor. So I will see you in July.
Great. Actually, I'll see you at DE.
Oh yeah, I'll see you in April. April. What are the
Great.
dates for DE? We can give a shout out to
Yeah,
DE
it's April 13th through 15th.
in
13th
Sarasota,
in
correct?
Sarasota. Yep.
Yep. So everybody go to DE.
Definitely
All
go.
right.
Awesome. Great.
Thanks
Thanks, Pat.
everybody. Let me
Thanks.
stop the recording.